Hello, everybody. Welcome to another episode of Youre The Cure. I'm Dr. Ben Edwards. Got a great show today. We're going to be talking about how do you afford healthcare. We need to put healthcare in quotations, I believe, because really it turns out it's sick care. What most traditional health insurance and what people think of when they think of health insurance, it's really paying for a system that's a system of managing chronic disease. If you've been a long-time listener to the show or even short-time listener, you know I'm a big proponent of don't just manage symptoms, get to the root of it, fix it, and be done with it. So attacking high blood sugar, which people call that a disease of diabetes, we attack that with metformin. It's a prescription to drive that sugar down artificially, or you can use berberine. That's a herb. Drive that sugar down with berberine. There's randomized published data on both of those, peer-reviewed, all the science to prove either one of those works really well, about equally. Berberine is a little better. Of course, no side effects with the berberine. But still, we're chasing a blood sugar level and try to push that thing down with one of these two options. And the high blood sugar is the smoke from a fire, and the fire is not being dealt with. The fire is insulin resistance, and really deeper than that is the inability of your carburetor, your mitochondria, to burn that sugar. We should be able to take a carbohydrate, especially if it's God food, not man food. God intended that whole grain to be ground and consumed, not grind it and then sift it. As you heard with our Sue Becker podcast, if you haven't heard Sue Becker, go back and listen to those. But once man sifted that grain, 70 nutrients got sent to the feedlot to feed the cows because that germ and bran goes bad. It spoils. It goes rancid sitting on the shelf. In about 4 to 6 hours, that thing's spoiling. So they had to sift that out. And what's left? Starch and protein. That's white flour. That kills you. And it was killing people in the 1920s. So they had to go back. The government made them go back and add in, it's called fortified, enriched, and fortified white flour. And they put in originally 4 nutrients back in 1998. They put a 5th, folic acid. And so those are synthetic man versions of those vitamins back into God's wheat. And all the God version of the vitamins, the 70, got sent out. So that is consumed by Americans. That's not food meant to be consumed. It's not even food. It's a processed food-like substance. I would not define enriched white flour as food. God did not intend for you to consume that. Your mitochondria, your carburetor was not designed by God to burn that for fuel. And when you do that year after year after year, it gunks up your carburetor, damages your mitochondria. And that mitochondrial damage causes it to not be able to utilize any carb. So now much less high fructose corn syrup and all the processed carbs, and that backs up in the system. It raises your blood sugar, and boom, you're called diabetic. You get put on a pharmaceutical or nutraceutical, push that number down, but you're not fixing the carburetor. You can remove that quote unquote toxin, the carb. You can go keto, low carb, and remove that thing from the system. Okay, now it looks better. Your blood sugar number came down, but just because you removed it from the system, you didn't fix the carburetor. And that's why long-term keto is not the most beneficial thing to do. And we got to get to the very root and fix it. Y'all know this very well if you listen to the program. And that's across the board. I pick on diabetes a lot because it's so prominent. And when your carburetor's broken to the point your blood sugar's rising and to be diagnosed a disease called diabetes, that increases your risk of cardiovascular disease, heart attack and stroke. It increases your risk of Alzheimer's. Most doctors call that type 3 diabetes now. There's such an association with this dementia and elevated blood sugar. Cancer, you increase your risk of cancer. So those are all the top killers, all rooted in metabolic dysfunction called diabetes, but from mitochondrial dysfunction. So just a little reminder there that all these diseases, quote unquote, in medical school, they taught us how to manage that smoke, how to open the windows, turn on the fans, keep that smoke calmed down so you would stay alive a little longer, but they didn't teach us how to get to the root and fix it. So that's what we preach and teach. We've been doing this for 12 years. And one of the beautiful things is you can't just quote unquote cure diabetes. When you fix that carburetor, everything gets better. So people sleep better, their mood gets better, their aches and pains in their joints get better, their heartburn and reflux and their blood pressure, everything starts to normalize across the board. It's awesome. It was so amazing when I first learned this. And then when the radio station here in town asked me to come do this show 10 years ago, they said, you need to name your show. So I just picked this name, Youre The Cure, because that's what I was seeing. The body fixes itself. It's amazing. We get it with a paper cut. It fixes itself. We don't stress out about a paper cut. We get it with a broken bone, no problem. That mends itself as long as you line that bone up. So we get it there. We don't get it with chronic disease, but that's what we teach and preach. So what about your health insurance that is going through the roof? They're pulling more out of your paycheck. Your copays are going higher every year. Your deductibles are going higher every year. These high deductible plans, you're responsible for more and more. Just to participate with Blue Cross Blue Shield and Aetna and all these corporate commercial insurances, you're having to pay, or your employer has to pay so much, it will bankrupt you, really. And for what? What are you really buying into? You're buying into a system of the world. And the ruler of this world is behind these systems of the world. Steal, kill, and destroy. That is his motive. And Jesus came to set the captives free. And part of that's lack of knowledge. My people are destroyed from lack of knowledge. So this comes full circle back to your wallet and stewardship, and not just your physical temple where the Holy Spirit's housed, but the stewardship of your dollars. So in with that line of thinking, I have people come to our clinic. A lot of them, like the woman with the issue of blood, they spent all their money on all these doctors, and money's a big stressor. I mean, the peace pillar we preach so much is the number one pillar. You can't be healthy with chronic stress. And one of the chronic stressors is financial. And I'll hear guys say, I'm staying at my job because I have to have that insurance. So we want to release you from that mindset. You don't have to stay anywhere. Number one, God's your provision. He'll make a way. But number two, through the knowledge and the stewardship that you're learning with our wellness program, you'll deal with the root cause of these things. You won't need to worry about pre-existing and having health insurance for all that. What you really end up needing is what my family needs: catastrophic accidents. You fall off a horse and break a bone. You get in a car wreck, someone rear ends you, whatever. You need the catastrophic coverage. Well, there's a way to do that very, very affordably and in a kingdom-minded way. You know, what were people doing hundreds or thousands of years ago? One doctor told me, one of my mentors told me, in ancient China, they would pay the doctor a little bit every single day until the day they got sick, they quit paying them. And once they were well, they'd start paying a little bit again every day. So that's kind of like with our membership model here in our medical clinic. We do a monthly membership, very reasonable, $70 a month. Pay us a little bit every month to help keep you out of our office. But you combine that with a very affordable other ancient strategy, sharing, especially if you're from the mindset or the beliefs of what Jesus taught and you're a follower of Jesus and what they did in Acts, and you shared, you help your neighbor, you love your neighbors yourself, and you meet their needs. If you have something and you can meet someone's need. So that's a concept in this thing called health sharing, healthcare sharing. And there's lots of different health share ministries out there. And I've invited a Samaritan ministry to join us today because I don't know that I'm saying I'm endorsing them, but obviously they're on the show. I love what they stand for. I love what they're doing. I love how they help take care of each other. Obviously they have a Christ-centered kingdom mindset. And Joel Noble is joining us today on the show to talk to us more, educate you, the audience, about what is health sharing, how does it work, the details of it, but also, obviously, I want to know more on this Samaritan ministry. I want y'all to know more about and kind of what they're rooted in, founded in, how they got started, what have they learned along the way, the ups and downs, and what's the best way do they feel like to steward your healthcare dollars. So, Joel Noble, thank you for joining us today. Welcome to the show.
Well, I appreciate you having me. Thank you so much.
You're very welcome. And Joel, I was just looking here to get your official. You're the Director of Public Policy. Is that right?
That is correct. Yes.
Okay. Well, maybe we just start with, if you don't mind, giving a little background just on Samaritan Ministry in general, the original founding of that, how that came about.
Yep.
When was that? How were those first few days and years going? And then kind of just the growth and where y'all are at today.
Yeah, absolutely. So our founder was actually a member of another formal ministry, similar Samaritan, that had predated us. So that ministry had actually started after a minister at a rescue mission was in a terrible car accident and lost his wife and one of his children, and was seriously injured, and some of his other kids were injured too. And he just put that in the prayer letter that he sent out, and folks started sending him checks to help with the medical needs that he had. And so he started a ministry to do that for other folks. And our founder was part of that ministry for a number of years. Believed in that concept, like you alluded to with the Book of Acts. I mean, this was not a new concept. What's interesting is health insurance is actually sort of a newer concept if you really look at it. In a former life, I was a history teacher, and one of the things that I taught about World War II was these price controls and wage controls. And you had wage controls, and the way to get good employees, you had to add something else into it because you couldn't raise their pay. So they added health insurance as a benefit, and that was really the beginning of what we see as employer-based health insurance. And so it was not really the model until the late 40s, early 50s when they did that. Before that, it was similar to what we did. It was just sharing of healthcare needs among the community. Maybe you're part of a benefit society, and that's how you shared. So our founder thought maybe I could do a couple things differently. Some things I wanted to change about it, that kind of free market, idea. And so he started Samaritan in 1994, similar model. And what he told those folks is once we get 100 people, we'll start sharing. So we needed, 100 people to kind of step out in faith and sign up, and before we started sharing. And really the Lord just protected those folks in those first years, because you can imagine, with just 100 families, a huge need comes in, it might wipe it out before it even got started. So Lord really protected that. There was some relatively large needs, and they just took several months to share that and get that taken care of. And those members stayed faithful to each other in sharing that. And so we're getting ready to celebrate our 30th year this fall. And so we're currently a little over 85,000 households. That translates out to a little bit more than 280,000 individual lives that are sharing among each other.
Wow, that's awesome. So for maybe some of the more hesitant or timid or scared folk, or
Yeah.
the CPAs out there,
So
as far as running into any trouble, if a perfect storm of lots of devastating high dollar claims come in, what's y'all's history or track record, as far as being able to pay claim or be able to share and meet all the needs?
yeah.
Or you ever run into trouble not being able to do that?
Yeah. So one of the things that our founder did decide to do was create what's called a Prata Provision, and it's something that's unique to Samaritan. And what we mean by that is, if any time that needs outpace the shares that are available, we prorate all those needs, and the members know that. So just for a nice even round number, if $1 million came in worth of needs, and the share ability was only 900,000, we would share 90% of those needs, and 10% would be prorated. So the member would not be able to get that 10% shared. But what has happened over the years is that folks step up and they give extra in prorated months. There's been times where just the way the needs flow, we've had the opposite the next month, where we've had more share power than needs, and we've been able to unprorate and go back and pick up that 10% or 20%. And so even in prorated months, the members are overly faithful and help out with that. And what that does is it allows us not to fall into a backlog to where we suddenly have to play catch up, and to where we suddenly have a whole bunch of needs that aren't being met, and they just keep piling up to the point where the members wouldn't be able to meet that. So the proration helps with that, and it also kind of gives us an idea of the sharing dollars of if that needs to be changed. Our guidelines say if we prorate 3 months in a row, we need to have a vote on a share increase. So we tell the members if the share would have been this amount. So currently a family of 7 or less, I believe, is at 695. So we would say, if it was actually at 710, we wouldn't have had a prorate. Or, for a couple, if it wasn't at 375, we wouldn't have to prorate. So we're suggesting we raise it to this amount, and then they vote on that. And so there's been times, over the years, when I first started 23 years ago, my family was sharing at 175, and I'm currently sharing at 365. So over 23 years, that's been the increase for my family. Since that time, we added a second program with a little bit more upfront out of pocket, and that's kind of why my share is a little bit lower. If I was in the classic program, it would be that 290 or that 695. So really, in 23 years, if I was in the same program, about $500 increase over that time, and that's been a result of the members raising that and voting it. And there's
Right.
times where we can see it coming and we instigate a vote, even ahead of the 3 months, to say, look, we can see this. We're not going to wait for, being forced into a vote. We think it's, a good time to vote. And there's times when the members say, no, we're not ready to increase it. We're comfortable with prorating, if we have to do that a couple more months, and they haven't, raised it. But, several times over, our 29-year period, those shares have gone up with the members voting to do that.
Okay. Well, that's pretty incredible. I mean, 20 years for your family
Yeah.
going up 500 only. And you mentioned if you were to choose that more upfront cost out of your pocket. So in health insurance terms, which I know y'all aren't health insurance, but for the audience's sake of understanding, similar to, a $5,000 deductible, that's going to be out of pocket for the insured person. They have to cover that before their health insurance kicks in.
Yeah.
So similar unshared amount is up to what? What are y'all's different
Yeah.
levels?
So we have a classic program, and that's what we've had, for the last 30 years, and that has a $400 what we call initial insharable. So the member knows that they're going to be responsible for the first 400 before they ask for help for the amount. And then we have basic is our second program, and that has a $1,500 out of pocket initial insharable. And so that has a lower share amount because you're taking more responsibility on the front end before asking for help, and so in return you're having a lower share amount. So 400 and 1,500. Also in basic, it's a 90-10. So when I have needs, I know that I'm responsible for the first 1,500 before I have any help, and then I'm going to also bear 10% of that need also. And so for me, I just see that ahead of time. I just pocket the savings into my savings account, and so I just try to keep that 1,500 there so that I know take care of that, and that has worked pretty well, at least for my family, just to keep that in savings to take care of that 1,500 on the front end.
Right. And how would it work, real practically speaking, if someone was a member of Samaritans? Say it's after hours and a kid falls, breaks their arm, they go up to urgent care, see the urgent care physician, get a cast or whatever, get an x-ray, get a splint, get a doctor's visit, pay. Do they present a card? Do they just pay cash and send you the receipt? How does that practically
Sure.
work?
Yeah. So our members, we just advise them to, present as cash pay on the. So in emergency situations, they that's harder to get that estimate up front, and so most, if not all, providers in an emergency situation are just going to bill you afterwards. Like you mentioned, that after hours, I had my now 15-year-old, when he was a little bit younger, broke the light bulb above his bed, playing, and didn't tell us. So he crawls into bed at 9:30 at night and slices his leg open on that glass.
Mm.
So, we're heading to the emergency room at 10 o'clock at night. And and I've shared this story a lot. One of the things that I love about Samaritan is I have a choice about the provider I want to see. And I literally had a choice in my town to turn left into one ER or right into another ER. There's two hospitals across the street from each other. The one on the right has a dedicated pediatric ER. And I knew that, this is a Saturday night. I knew where the gunshots and the drug overdoses were going to be. And it
Mm.
wasn't going to be the pediatric ER. At least I assumed. That was great.
Yeah.
And so, to be able to, as his dad, choose that was wonderful. And so, in that situation, I received, a bill, a week, 2 weeks later. And then I start that process with Samaritan, either online or with a phone call. And it's just a form to fill out, describing what happened, how the members can pray for you, and then you submit your original itemized bills so they can see that, okay, so, Luke Noble, needed stitches. And so they look at that bill and they see an ER visit, they see, those stitches on there, and they line up those charges on that bill to what I'm turning in as a need.
Okay. And then they just get or y'all pay directly to the provider.
No, we don't. So that's a great question. I'm glad you asked. So what happens then is really kind of the other beauty of it is we assign members to send directly to the person in need. And so when he cut his leg, I turn that in 30 to 60 days later, depending on how quickly it's processed. So the difference in the time frame is when I turn it in the month. And so normally, if you turn something in earlier in the month, then it gets processed and it can get published. So like an April need was hopefully going to be published in June. If I were to turn that in at the end of April, it may not make it until July instead of June. So that's the difference between the time frames. And then I just receive those checks in the mail or maybe through electronic, system like PayPal. And so Luke's older brother, college athlete, blew his ACL out this fall in the preseason. So we're dealing with about $48,000 of surgery and rehab and stuff like that. And so I've just, for a while there, every day I'd come home and there'd be a couple envelopes in the mail and with checks from all over the United States helping out with that need. Or I would, log into PayPal and see, some folks that sent it that way. But it's all direct member to member. So we're not paying the providers except in extremely rare situations to where they're being, kind of obstinate and they, won't do anything unless they're paid up front. And then we have to work that out, with them. And we, try to get the checks then quickly to the member. And we have, some member assistance funds that have been charitably given that, we can help out up front, at times. But that's extremely rare that we're ever paying the provider. It's always member to member.
Okay. And then are there certain things, I know every health share is probably different on this, but as far as you wouldn't cover, and I'm thinking more not emergency stuff, but like chronic disease type things, routine care at your doctor's office for diabetes or whatever.
Yeah. So there's the things that would fall into the, I guess, I don't want to say moral, but things that are outside of the members' biblical beliefs that aren't shared at all. Things like abortion or gender reassignment, things like that. And so the members don't share in that at all. And then there's things that we have to limit the way we share. Things like pre-existing. Because if we did, then the share amount would be unaffordable. We wouldn't be able to, members help at all if we, shared and everything through routine. We do have what's called special prayer needs. So when I get my slip telling me who to send to, it may say, Bob Smith broke his leg. Please send your 365 to Bob and pray for him. The bottom of that slip, there's going to be another need on there for something that was not shareable. And, maybe it's dental, maybe it's routine, or something that just falls outside the guidelines. And then I can help out, basically a free will offering and send them, $20, $30. And so we put that on enough of the share slips that if everyone sent, $20 or $30, then that need would be met. And then there's things that we need some doctor's guidance on, things like a hernia or maybe TMJ or, even diabetes, things that possibly folks could be living with, before becoming a member, and then, join afterwards. So we want to just clarify with the doctor if this was pre-existing, if they had any symptoms or treatment of that. That's kind of how we determine pre-existing is symptoms. If you had symptoms or treatment prior to that. And so there's a few things where we're going to want a doctor's verification that, they weren't already treating this before becoming a member and that it's not, pre-existing. And then there's other things that there's, even when they're pre-existing, can, after they've been cured or arrested for a number of years, that we can start sharing again. And, diabetes would be one of those. If you get it under control, there's no symptoms, going on in that. And then we can start sharing in that if it comes back, if those symptoms come back years later. So,
okay.
Yeah, a lot of things that, just because it was pre-existing at one time, there's, things that can be treated and arrested that you can go, a long time, without having, any symptoms. And, we want to try to help as much as possible along with the members.
Right. So, how did you first get into this yourself or hear about it?
Yeah. So my wife was homeschooled, which was a little bit rare in the 70s and 80s. And so it's kind of a small community at that point. Wasn't as common then. So she knew another family down the road, and that family happened to be one of the original employees at Samaritan. And so she knew about that. She knew that they were looking for a proofreader. She was in college at the time, an English student, and so came on to Samaritan actually as an employee to do proofreading the newsletter and to help out writing the prayer requests, things like that. And so we were actually engaged, I think, at the time, and so that's how I became aware of Samaritan. As I mentioned, I was teaching school at the time, and then decided fairly quickly that the education bureaucracy wasn't, really fitting well with me. I love teaching. I still love teaching when I can, but I did not like the state educational system. And so actually I was looking for a job, and I went back to retail, and Samaritan had said, we're looking for some folks, still. And so I applied and started working really with the intention of just, working until I found another teaching job, a better teaching job. And then, like I mentioned, woke up 23 years later and I'm still here. And fortunately, I started off just processing needs, working with the members. And then around 2016, with the passage of the Massachusetts mandate, which was the precursor to the Obamacare insurance mandate, we saw the need for public policy and having kind of a legislative affairs. And I was a history teacher, political science was my background. And so just had the opportunity to move into that in the early stages. And that's where I've been ever since, doing the public policy and the legislative side of it.
Okay. Well, maybe speak to that a little bit. Obviously that, again, quotations here, healthcare industry,
Yeah.
Insurance. That's a huge beast of a system. No pun intended, but just so many dollars, so much influence, so much lobbying going on. Are health shares considered, small fish, not a big kind of threat from a money, market share standpoint? Are there issues there? Are there things y'all have to do legally to protect yourself? Do people, or, anybody, legislatures or otherwise, like the Obamacare stuff? Just talk a little bit on that side of things. Any challenges or things that coming down the road that you might see as a challenge?
Yeah, absolutely. So in the early years, it was a lot of just flying under the radar. and don't let the insurance bureaucracy or the Department's insurance know that you're there. And as I mentioned with the mandate in Massachusetts, what happened is they passed that, and then they had to build it and basically kind of design how it was going to work. And just completely through God's provision and grace, we talked to somebody that was in the process of basically writing the regulations, and said if we would have known about you, we probably could have put some kind of exemption in there. And so that was kind of an awakening of like we needed to be more present, we needed to be more active in that. Fortunately, they did write an exemption for healthcare sharing into that. So our members, when they in Massachusetts, when they file their taxes, they just fill out a extra form for an exemption, so they don't have to buy insurance there. And that same kind of provision that we got there then led to when the Obamacare was passed. It was modeled a lot after the Massachusetts law. And so we were, just making the case of this is similar, we need to be exempt. And it really just absolutely was God's provision. And you can imagine the people that were lobbying around, the Affordable Care Act, and talk about small fish. We're, nowhere near, we're an inkling of the of lobbying dollars that an insurance company would have. And it was honestly God's provision. And we had a relationship with a state legislator who was a family friend of the ranking member on the finance committee in the Senate. And they put an exemption in the version that was in the finance committee. And if you know anything about the ACA or Obamacare, there was several different versions out there. There was, 3 or 4 of them, and one of them was in the finance committee. And so they sent that over to the House from the Senate. When it was in the House, Senator Ted Kennedy passed away. And if you know the history of that, then Scott Brown got elected, and it basically turned the majority of the Senate. And so they couldn't send it back to the Senate because it would have been stopped in the Senate. So they went ahead and passed the version that made it to the House, which was the version that had our exemption in it. And so it's one of those, we talk a lot about kind of the rocks in the Jordan, the Israelites of remembrance. And so that's one of the huge ones, was the exemption in the ACA. And then other than that, one of the main challenges we have is just making sure that state insurance codes don't try to regulate us. And so what we've done over the last 20 plus years is pass what we call safe harbors. And we go to the state and then write in their insurance code, or reference the insurance code that says if you're a healthcare sharing ministry and you look like A, B, C, and D, and you do this, then you're not subject to the insurance code. So 33 states have put those in their insurance code, explicitly exempting us from the code. And that protects us then from the mandates that are in insurance codes. It protects us from well-meaning insurance regulators, that want to try to regulate us. We're still, active in all the other 17 states, but it's just not as clear in there. And so, not that we're waiting for the other shoe to drop there, but it's just clearer in those other 33 states. As you mentioned, one of the challenges, one of the states that don't have that is New Mexico. And New Mexico has taken somewhat of a special interest into healthcare sharing, and they have shut down 5 of the ministries so far, deeming them insurance in there. It was the smaller ones, and which I think they were trying to get the low-hanging fruit, the ones that maybe didn't have the strength or the membership behind it to fight that, because most of them, or all of them, basically rolled over and just left the state. So seeing that, we thought we're not going to wait for them to come to us. And so first we told our members, what was going on. And then we also stopped taking new members into Mexico just to protect that in case something did happen. And then we filed a federal lawsuit saying that, you've come after these other ones. We're not going to wait for you to come after us. What we're doing is, just sharing among members. We have religious freedom to do that. So we filed a lawsuit under religious freedom, that we have the right to share, medical needs amongst each other. And this is not insurance. It's really at the beginning. And so it's just a lot of legal wrangling now where, they, put in dismissal. We say it shouldn't be dismissed. And they say, we say we want to, the judge to rule, and they say no. So it's a lot of just legal paperwork now.
Yeah.
It's a little bit out of my pay grade, but we're optimistic there, and hopefully, we get a good ruling there in New Mexico.
Well, good for y'all for standing up and being proactive on that. We've got a lot of patients here in Lubbock that are actually from New Mexico, so it'll be good for them to hear that y'all are doing that. Kind of maybe share with the listeners what you would consider kind of the ideal person, the ideal candidate to be a member, obviously like-minded in their beliefs. I would think, it would tend to be the young, healthy, folks that are having to pay an arm and a leg for this insurance and not using it. But, maybe that's just my thinking's off. Middle age, older folks, Medicare age, kind of talk through the different areas in life or ages in life where this might be more ideal or less ideal. Do you do it with Medicare or not with Medicare or all that?
Yeah. So, like you mentioned, the young invincibles that, don't think that they need anything works, great for them. Especially when the ACA was still had a penalty in it before it went to $0. We would see a lot of the younger folks coming in. I think maybe initially, looking at something different than insurance, because at that time, if you had to buy insurance or you were penalized. And so folks started investigating everything that was out there and discovered healthcare sharing ministries, during that time. So worked really well for the young, invincibles. So among the ministries, we're usually around about 3.4 members per household, and which, I have good relationships with the other ministries, and I, kind of know their size. And there's something kind of unique about us. We seem to have the large families with us. I know a lot of the other ministries are, under 3 per household. And so for whatever reason, the large families really tend, to come to us. We have folks that stay on us after, they go on Medicare. It's not a lot, because one of the things, at least, my role as public policy, is to kind of alert them to, if they don't take Part B when they're eligible and then go to it afterwards, they get penalized for every year they didn't take B. And so I just kind of, we help the members be aware of that if they're going to opt out of B and not take that if they do go back to it, they're going to, be penalized with the premium cost of that. But we do have folks that still stick with us, through Medicare, still love it. I think we're trying to figure out a third share program for those folks, because obviously, a big chunk of that's already being paid by Medicare. They're not really, putting in, they have lots of needs, but the dollar amounts of their needs is obviously, not as high as everyone else's, because Medicare is taking care of that. So what's one of the things we're working on, hopefully for the future, is, a share for the folks that are on Medicare, since they're really not, putting their bills aren't, as high as everybody else's. Really, ideally, in any age group, just folks that don't want to be locked into a system. I mentioned, my son and going to the ER and choosing that. I talked about the one with the ACL. So as an athlete, when it, determined that his ACL was torn, he wanted to get back in as quickly as possible. He was, biting at the, to get back on the field. So he started doing his own research, and was actually looking into, some different procedures. Traditionally they just, repair that ACL. There's a new procedure called a bridge, and it's similar to, I think, what Aaron Rodgers did on his Achilles, if you're familiar with that. And
Yep.
so it's this bridge surgery. They put in an implant between the ACL, and then it basically grows into that, and then that implant dissolves. And so he looked, into that, and ultimately decided the recovery was no quicker, and it was actually going to come back stronger with traditional surgery. But that was a choice that we were going to make as a family, and it wasn't, my employer, it wasn't the government saying you have to go to this doctor. And ultimately, we're in Central Illinois, and we ended up going about 2.5 hours south down to Washington University outside of St. Louis, because after some research, he knew that the doctors there were actually working on professional soccer players at the university there, and had really good experience with soccer players in ACL. And so, we made that choice. And so, there's, folks that go to the Oklahoma Surgical Center, that's a cash pay place. And there's more and more clinics like that opening up. And probably as much as I hear about the cost savings, I hear about the freedom. And so folks that are just tired of being locked into a system are great candidates that, don't want to be told, I have to see this doctor or that doctor.
Yeah.
Yeah.
Well, that kind of leads towards a question on covering more holistic, integrative, even international. A lot of cancer clinics in Mexico. I would assume y'all wouldn't cover an international, but and I've looked at some health shares that do and don't cover. And holistic, that's a broad term. That's a whole potential huge thing. So how do y'all handle those kind of requests or clinics?
Yeah. So, those are things that we share. We believe, I don't believe, I know, the provider needs to be licensed. And so, but licensing, it's not just an MD. There's other, license you get in that. But we do have, international patients. We have folks that are on the mission field, and so that are being treated overseas. And really, the only limitation there is just English and the U.S. dollar. We just need them or have them translate that to English and the dollar, so that we know what we're looking at when we get the bill. So we know there. But we have, and I know we have members that have gone over the border for maternity. I know places like, I think, Costa Rica had really good maternity and like color ultrasounds, many years, or ultrasounds many years ago. And we had members that chose to do that. And we actually, if it's a savings, encourage medical tourism, because a lot of times, you can, even if you travel and the meals and the plane ride ends up being a whole lot less expensive than maybe your local hospital visit. And so when there's a cost savings, we even incentivize that, and would share, the travel as that medical tourism to encourage that. Because if I'm in Illinois and I go over to the Oklahoma Surgical Center and that's $10,000 less, and I spend 2 nights in a hotel at $100 a night, that's, my math is right, 98 100 of savings. And so and that all that helps the keeps the share low, and that keeps the proration from not happening. And so that's you asked about members we're looking for. We're also looking for members that are price wise and are looking for fair prices.
Yeah.
And so I came out of an insurance world. My dad worked for a Fortune 500 company. We could just like walk in and show a card, and then as a kid, magically that was all taken care of behind the scenes. Excuse me. But we didn't, even though we had that, we were a family that never, really, just ran to the doctor at every little, sniffle. We were good or bad, kind of, rub some dirt on it, get back in there. And so, they came kind of naturally to me to shop around and, to, look for a fair price and seek that out.
Yeah. Well, what about employer-based health sharing? Do y'all work with small companies, medium-sized companies? Is there any opportunities there for employers looking for a better option for their employees?
Yeah. Yeah, we do have, and a lot of it would be like ministries or churches where, they bring on their whole staff. Because we're faith based and there's, we're asking the members to sign off on, a basic statement of faith, a kind of a Nicene Creed type of statement of faith. Um, that does provide some limitations to like a mixed company that doesn't
Mhm.
have strictly all Christian employers, but we have folks that do have a mix like that and put on the ones that can meet the membership requirements. And then we basically just treat them, even though they're a group, that we still treat them as individuals, but just like collective individuals.
Mhm.
And so they're still sending their shares individually. Sometimes in the church, they may give that to the secretary or the treasurer, of the church, and that they'll send the church check. But we're still treating those individuals, so they understand the sharing model, and they understand the community, so they can be praying for each other. Um, so companies or ministries that are over 50, they still have the ACA penalty, and so we work with them to kind of explain how that can work for them. And what a lot of them do is they go with the sharing, and they get like a minimum essential plan that they really don't use, just a really cheap minimum plan, which then satisfies the ACA there. And a lot of times it then also opens them up to other benefits like a health savings account that can be hosted in
Mhm.
that. And a lot of them don't even use that. They just use it as a vehicle to avoid the penalty, and also use that HSA, and then they just use the sharing to actually take care of the medical needs that occur.
Right. Yeah. That's awesome.
Yeah.
Um, Talk a little bit, this kind of going backwards. Some folks that still might be a little hesitant. What kind of dollar amount are we talking? I think someone had, or I read it somewhere on your website, maybe, but like total medical needs, in your history, do you have that number? Just to like give people the confidence that y'all are a big time.
Yeah.
There's some dollars that have been shared between
Yeah.
these brothers and sisters of Christ.
Yeah. So in the last 12 months, it was right around 38 million
Wow,
every month.
that's
So
amazing.
yeah, so probably just a little bit south of 400, 400 million in the last 12 months. But yeah, we've been looking at in it. Like I said, it ebbs and flows, but usually 33 million every single month, member to member. And there's been needs, that have been in the millions of dollars. I believe she's in Oregon, if I remember, a small preemie that was well over $1 million, and
Mhm.
after discounts. Um, Sometimes folks are scared, of those, hear those $1 million, how's it going to work? Um, as you may know, a lot of times costs are highly inflated.
Yeah,
And so,
big
uh,
time.
yeah, and I've seen that too. And so, we see the large needs, but very often working with providers, members even themselves working with providers, those come down to more reasonable costs, especially when you're talking about $1 million need, and you say, well, through this, and I'm going to get checks in the next 60 to 90 days, I can give you 500,000 cash on the barrelhead. um, you know, Most times they're gonna, take that, realizing like, because sometimes the providers are scared too, like, Jesus, person doesn't have insurance. We just $1 million need, and they see that too and say, yeah, absolutely, I'm gonna, we'll take that. And I mentioned that ACL with my son. it's 48,000, but it was probably well into the 60s when initially.
Yeah.
And just working with them and setting up a payment plan, and saying like, we'll pay all of this. What can you do? And getting that down closer, with all these doctors and surgery, more into the 40s into the 60s.
Right. Well, this is a little more of a personal curiosity. Do y'all run metrics on that, on that 38 million? How much of that's going to kind of more unavoidable, the car wrecks, the ACLs, injuries, traumas, versus more the chronic type conditions?
Yeah, we do. We have a business intelligence department that does that. Honestly, and I don't want to say it's. I mean, I guess it is avoidable, but I mean, one of the largest probably drivers is maternity.
Yeah.
And so, I don't want to put that in the same category as a lifestyle issue, to
Right.
where overweight or something else. But that's a large driver there. But still, cancer is huge, and there's a lot of that probably could different ways could be avoided. Through the membership requirements, the folks are abstaining from smoking or drinking to excess. So some of that on the front end, through that, but at the same time, we also have done uh, like finance surveys to try to figure out where our members are at, financially. And the last one we did was about 3 or 4 years ago, and it was about 54% of our members are below 200%, or other way around, 46% are below 200% of the poverty line. And so, by and large, our members aren't really the wealthy, in society. And I think we know too that often, with low income also comes sometimes bad eating habits, bad, health choices.
Yeah.
Uh, you're not eating as healthy as you can be. You're buying that processed food. You're buying that frozen pizza, and I love it too. Even if I could, there's times, even if I could afford to eat better, sometimes I like, that processed food.
Don't tell me that, Joel. I'm going to start preaching.
I know. Yeah. So, yeah. So even though some of the, lifestyle issues with the membership, avoid that, we also have members that, come to us because of cost, and that also, brings some, bad habits. So I'm sure, like, like you said, there's probably, through better health choices, and often that's where our newsletter comes in, that we're putting out. We're trying to, educate our members on things like that, and better, choices in their health, and how they can, hopefully be better in that, and that helps everybody then.
Right. Well, we're almost out of time, Joel, but I do want to hit on, and I think one of your colleagues has sent me some stuff y'all were doing, maybe internationally and not internationally, but just almost like some ministry type opportunities where y'all are able to have some amazing impacts, really, around the world. Can you share some about that?
Yeah, absolutely. So, us personally at Samaritan, many years ago, we started a group called the Morning Center to do maternity care, free, completely maternity care. They're in Memphis currently, and they have mobile units. Because what we saw was that in a lot of areas, the majority of maternity needs were being paid by Medicaid, but by the state. And we just thought, this is really not right, especially in ministry. And so it's one of the things that we started to help with maternity care there. They're, we still help them. They're independent from us. They're starting other cities. So that's one of the ministries we've been a part of.
Mm-hmm.
But then, among our membership, we have just tremendous members that, through their savings and through the opportunities, can do ministry on their own. there's a lady in Georgia that's the director of a group called the Miracle League. And what they do is they provide baseball for kids that have a handicap. And so they provide fields that are rubberized. One of the biggest challenges to that is, crutches or wheelchairs would be the grass.
Yeah.
And so they design fields that is accommodating to wheelchairs and walkers and crutches. And so that these kids, even though that they have, this limitation, can still play baseball. And I love that she's doing that. We had a member that had a just terrible bike accident, with a lot of head trauma, came through that. And after that, just amazingly found that he could write scripts really well. And now he's in the movie production, and just something about that. And so now he's, in that, using that as a ministry. And then we have all kinds of folks on the mission field, serving all over the world, and that otherwise wouldn't be able to if they had to buy insurance, and especially when they're raising their own support.
Yeah.
So, just, tremendous members out there. And we even, I'd have to look, see if you're still a member. We had a former, pro wrestler at one time. Even a few legislators throughout the years have come and gone. So even that attracts, sometimes.
Yeah, that's neat. Well, y'all are doing amazing stuff. I appreciate the ministry and the opportunity that this healthcare cost thing is just driving so many people really into unsustainable states. I know a lot of businessmen in particular with their employees trying to provide something for them to help their employees, their greatest asset. So just knowing this is an opportunity even for business leaders, men and women both, to have another option. So it's, just a kingdom way to another kingdom system. It seems like God's really just moving in the earth right now and setting up some different kingdom minded ways to do things, programs in the world. And this is one of them for sure, this healthcare sharing. So thank y'all for what you're doing. And I did want to mention, this is unrelated to Samaritan's Purse, Franklin Graham, and that similar name, but unrelated. So SamaritanMinistries.org, is that the website?
Yep, SamaritanMinistries.org. A lot of good info there. You can find, hopefully most of the info. If you don't, there's a phone number there. And I say this every time I can, that the folks on the other end of that phone are there to answer questions. They're not incentivized at all to sell you Samaritan. They actually don't want to sell you Samaritan. They want to explain it to you, because they realize if you understand it, that you'll stay a member. And so there's not a question, I think, that's come up that they've not heard before. So yeah, SamaritanMinistries.org. If you don't find it there, call the number. But you can still send your shoebox to Samaritan's Purse too. Like I'll give them a plug, even though they're unrelated. Great ministry. So still do that too.
Okay. And just real quick, I know people can find this on the website probably, but you mentioned for a family costs. So if it's a young person versus a couples versus family, give the ballpark. I know there's various packages or programs.
Yeah. So basic program, a single young person, off the top of my head, I think it's around $150. And then classic with that, $400 initial and shareable, a family of 7 or less, I believe is at $695 now. But I may be, so if I'm wrong, the price calculator is on the website there. And so it's a little bit higher for a family of 8 or more. But yeah, check that out. And there's a few categories in there: age, and then family size, and the 2 different programs. And just plug in your info, and you'll get your monthly share amount.
Yeah, that's awesome. So guys, I encourage y'all to check that out, SamaritansMinistry.org. And really, I mean, of course, little plug for us, $35 a month for our wellness education program to teach you how to not get diseases or to reverse your current diseases, or $70 a month to be in the medical practice if you're here locally or in Texas. or even out of state. You just have to come for your first medical visit in state. But either one of those, 35 or 70, and then with Samaritans, I mean, you're all in, even if you have a big family. That's a lot of these insurance plans I've heard about recently. People paying $800, $900, $1,000, $2,000 coming out of their paycheck a month, again, just to participate in that system that produces such poor outcomes. So what a beautiful combination, if I do say so myself.
Yeah.
Veritas Wellness, veritaswellnessmember.com. You can go check out what we have there, guys. If you're already a member, we've added the text updates. So we have videos, education coming out automatically every week on that text. So go sign up for that. Of course, our newsletter is coming out every other week. Go check that out or sign up for it on the website. And of course, join if you'd like to and get educated on how to avoid your doctor, how to stay out of the doctor's office. That's our goal. And then go check out SamaritanMinistries.org for those catastrophic needs and how to help your fellow brothers and sisters in Christ cover their needs. What a great ministry. So Joel Noble, thank you again. Appreciate you spending the hour with us.
Yeah. Thank you so much for having me.
You bet. All right, everybody. I'm Dr. Ben Edwards. Remember, you're the cure. We'll see you back next week for another great show. Y'all have a great week. Bye-bye.